Hello and welcome back to our channel. Today we're going to be talking about a common skin condition that affects millions of people around the world, rosacea. This condition causes redness, visible blood vessels, and bumps or pimples on the face, and can be frustrating and uncomfortable to deal with. In this video, we'll cover everything you need to know about rosacea, including its causes, symptoms, and treatment options. So, what exactly is rosacea? It's a chronic skin condition that typically affects the face, although it can also occur on the neck, chest, scalp, or ears. Rosacea is more common in people with fair skin and tends to affect women more than men. The exact cause of rosacea is still unknown, but it's believed to be a combination of genetic and environmental factors. Some people may be predisposed to rosacea due to their genes, while others may develop it due to factors such as sun exposure, temperature extremes, stress, and certain foods and beverages. There are 4 subtypes of rosacea, each with its own set of symptoms. The most common subtype is called erythema telangiectatic rosacea, which causes persistent redness and visible blood vessels on the face. Another subtype is papulopustular rosacea, which causes acne-like bumps and pustules on the face. Phoematis rosacea is a rare subtype that causes thickening of the skin and enlargement of the nose, while ocular rosacea affects the eyes and can cause redness, dryness, and irritation. Symptoms of rosacea can vary depending on the subtype, but some common signs include persistent redness on the face, flushing or blushing easily, visible blood vessels, and small red bumps or pustules on the affected area. Rosacea can also cause a burning or stinging sensation, and in severe cases, it can lead to thickening of the skin and permanent scarring. If you suspect that you may have rosacea, it's important to see a dermatologist for a proper diagnosis. Your dermatologist may perform a skin exam and ask about your symptoms and medical history. In some cases, additional tests may be needed to rule out other conditions. Treatment options for rosacea vary depending on the severity of your condition. For mild to moderate cases, topical creams and gels may be prescribed to reduce inflammation and redness. These may contain ingredients such as metronidazole, azelaic acid, or sulfur. In more severe cases, oral antibiotics may be prescribed to control bacteria and inflammation. Isotretinoin, a medication commonly used to treat acne, may also be prescribed for severe cases of rosacea. In addition to medication, there are also lifestyle changes that can help manage rosacea symptoms. These include avoiding triggers like spicy foods, alcohol, and hot beverages, wearing sunscreen, and using gentle skincare products that are free of irritants. In summary, rosacea is a common skin condition that can cause redness, visible blood vessels, and bumps or pimples on the face. It's important to see a dermatologist for a proper diagnosis and treatment plan, as there are a variety of treatment options available depending on the severity of your condition. Remember to take care of your skin by avoiding triggers and using gentle skincare products. Thank you for watching, and we'll see you in the next video.